Reporting to you live for this breaking news segment. My name is Brooke Poole with Station Drug 4. Today we're going to discuss SERMs, otherwise known as selective estrogen receptor modulators. This drug class includes tamoxifen, raloxifene, lasofoxifene, bazodoxifene, and clomiphene citrate. These medications act on the estrogen receptor to either mimic or block estrogen's effects in different tissues. The various therapeutic effects of SERMs are increasing bone density, reducing bone resorption, reducing fractures, and also preventing cancer cell growth by blocking estrogen receptors in the breast, the uterus, and the vaginal wall. Alright, let's cut over to Brooke Poole to further discuss SERMs. Thanks, Brooke. This is Brooke Poole reporting live to further discuss SERMs. Let's talk about the pharmacodynamics. They're essentially the main effects of estrogen, such as maturation of the reproductive organs, development of secondary sexual characteristics, regulation of the menstrual cycle, and maintenance of bone density and normal structure of the skin and blood vessels. What about the pharmacokinetics? Absorption from the GI, distribution widely distributed in most tissues, particularly tissues that inhibit estrogen receptors. The metabolism is in the liver, and then excretion is, of course, through the feces. Alright, now back to you, Brooke Poole. Well, it seems that we have lost connection to Brooke Poole. Brooke, are you there? Are you there? Come in? Okay, we must go on. Precautions to SERMs are congestive heart failure, renal or hepatic failure, abnormal uterine bleeding, elevated triglycerides, cardiovascular disease, leukopenia, thrombocytopenia, contraindications, DVT, PE, pregnancy, current or prior estrogen-dependent cancer, abnormal uterine bleeding, atrial thromboemboli within the last year, clotting disorder, severe hepatic disease. And then adverse drug reactions, myocardial infarction, hypertension, blood clot, abnormal vaginal bleeding, chest pain, and sudden vision changes. Alright, let's see if Brooke's in.
Brooke, we're back on air.
Oh, hey, so sorry. This is Brooke Poole reporting. It's a little windy out here today. We are here to discuss the drug reactions of SERMs. Raloxifene was warfarin, thyroid agents, and cholecystiramine. Then tamoxifen is warfarin, SSRIs, anastrozole, and St. John's wort. So if you take any of those medicines, you need to stop taking your raloxifene or your tamoxifen. Okay, well, what about the indications in clinical use? Raloxifene is to prevent osteoporosis or treat osteoporosis in postmenopausal women. It also reduces the risk of invasive breast cancer in postmenopausal women who do have that osteoporosis. And then tamoxifen treats estrogen receptor positive breast cancer and also reduces the risk of breast cancer in high-risk women. And then you do have the clomiphene citrate, which does actually cause ovulation in premenopausal women with infertility. So that one's kind of different than the other one. Okay, the sun is going down. It's windy here. Alright, let's go hopefully back to the studio. Thanks, back to you, Brooke. Here is a short commercial break regarding some SERM information. Rational drug selection. You need to consider the cost of a drug, route of administration, age and sex of patient, risk versus benefit of taking the medication, patient's current medications and diseases. As far as monitoring goes, you need to monitor the blood pressure, CBC with platelets, lipid panel, liver function test, get a mammogram prior to administration, pregnancy tests, pelvic exam, signs and symptoms of DVTs, and seizure medication drug levels. Patient education. Take the medicine at the same time every day. Avoid prolonged restriction of movement. Engage in regular weight-bearing exercises. Stop smoking. Report vaginal discharge or bleeding, leg cramps, weight gain, or signs of adverse effects. And prevent pregnancy. Alright, this is Brooke Poole closing in on the breaking news segment, SERMs. We're going to do the main takeaways. So we're going to spell SERMs. S stands for stroke and thromboembolism risk. So stop smoking. Don't take if you have a history of the stroke or thromboembolism or heart disease. E stands for estrogen receptor. SERMs mimic or block the effects of estrogen. R stands for raloxifene and tamoxifen, two drug names of SERMs. M, take your medication at the same time every day. And S, safe sex, avoid pregnancy. Alright, that's all from now. This is Brooke Poole reporting for Drug 4.